Hello, my name is Rachel Vance, and I am a junior health science major. My presentation today is music therapy and its effects on Alzheimer's-related anxiety and depression. Alzheimer's disease affects nearly 50 million people around the world. With only 1 in 4 cases being diagnosed, many cases go undiagnosed or misdiagnosed. The rate of AD is 2 to 3 times higher in women than men. The rate is also higher in the white population compared to any other ethnic group. AD is most common in individuals 65 years and older, but the disease can appear up to a decade earlier or later, meaning this disease is not a normal part of aging. Risk factors for AD include aging, diabetes, high blood pressure, high cholesterol, smoking, a family history of dementia, heart disease, and stroke. The death rate for elderly patients has increased 39% over the last decade, possibly due to the exceedingly high cost of treatment, $227 billion. There are few specific drugs to help with AD, and those prescribed may have severe side effects, with depression and anxiety being the most common, which can lead to a reduced quality of life for the patients. The side effects for AD have led to increased interest in non-pharmaceutical options to help patients with related anxiety and depression. The more common non-pharmaceutical treatment for AD is music therapy. Current research suggests that focusing on music that was familiar to the patients and listening to this via active interaction like singing or dancing for an extended period has positive effects on the anxiety and depression experienced by patients with AD. Therefore, the purpose of this study was to determine if patients 65 years and older who undergo music therapy have reduced AD-related anxiety and depression compared to those patients who did not undergo music therapy. These findings will help improve Alzheimer's patients' quality of life. By exploring new and alternative therapies, researchers can help individuals with AD overcome anxiety, depression, or the feeling of being a burden to those who care for them, and they can enjoy their life better. Primary sources pertinent to this systematic review were retrieved in January and February of 2021 from search engines PubMed and CINAHL. The terms used in both search engines are as follows: Alzheimer's, depression, anxiety, and music therapy. Additional articles were gathered from citations within sources obtained from the main search. However, the search was narrowed down to 9 articles after screening. The search began with 926 articles identified from PubMed and CINAHL and was narrowed down to 18 articles after duplicates and irrelevant articles were excluded. PubMed produced 12 of the starting articles, and CINAHL produced 914 of the starting articles, but many didn't include the proper criteria of the search terms, and 82 were excluded. For this review, the comparison between music therapy sessions and the decrease in AD-related anxiety and depression was measured by the Hospital Anxiety and Depression Scale, the Hamilton Scale for Anxiety and Depression, the Mini Mental State Examination, and the Behave AD Scale. This review included 2 randomized control studies, 3 quasi-experimental and exploratory studies, 2 case-control studies, and a clinical study. The use of music therapy to decrease AD-related anxiety and depression showed favorable results throughout the reports. One of the quasi-experimental studies looked at the effects music therapy had on cortisol levels and the correlation to AD-related anxiety and depression, indicating a positive correlation between decreased cortisol levels and anxiety and depression. The clinical study determined that music therapy restored hormone levels without side effects, decreased anxiety and depression, and was overall a good alternative to hormone replacement therapy for mild AD in women. All reports showed a positive association between music therapy and a decrease of AD symptoms. However, they also found that music therapy is most effective when accompanied by prescribed medication and when music therapy is incorporated into their daily routine. Music therapy has shown to be one of the more effective alternative treatments for Alzheimer's-related anxiety and depression. However, the most effective strategy is a combination of music therapy and medication already prescribed. The least effective strategy was stopping the intervention once the study was over, as the symptoms seemed to increase a few weeks later. Though the case study had a very small sample size, the positive effects of music therapy on the individual's everyday life while they adjusted to a long-term care facility were outstanding. This systematic review found that music therapy is a useful non-pharmacological intervention. There was a confirmation that efficacy of music therapy on anxiety and depression via sensory, cognitive, affective, and behavior effects, as well as cognitive stimulation. Most of these studies were quasi-experimental or exploratory studies, making these weaker in comparison to the randomized control studies. The biggest weakness was the relatively small sample sizes, meaning they may not be accurately representing the population of those with Alzheimer's-related anxiety and depression. Another weakness was the relatively short intervention period of each study, meaning more than one study indicated that treatment should be incorporated into everyday life to be most effective. To alleviate the shortcomings of the studies, increasing of the sample sizes and the intervention periods to be lifelong would allow for an in-depth look at the long-term effects of music therapy in Alzheimer's-related anxiety and depression, and could lead to an evolution in the type of music therapies administered. The findings of this systematic review should guide caregivers, family members, the public, and specialists on the most effective treatment option for Alzheimer's-related anxiety and depression. However, further research will help decide the most effective music therapy interventions, like singing, dancing, or playing instruments on anxiety and depression. In conclusion, music therapy is more cost-effective than traditional drug treatment, making it easier to incorporate into everyday routines of patients and allows the patients to regain some normality that they had lost due to Alzheimer's.